Education is the only weapon one can use to build a healthy and educated population for a stronger nation. And to do so when one lived in a Crown Dominion country was a bold move. But late Principal T.A. Kulkarni was a passionate persona, driven by the thought of providing quality education to each and every level of the society and enlighten every life with the power of education. Influenced by Namdar Gopal Krishna Gokhale, Guru of Mahatma Gandhi, Principal T.A. Kulkarni founded Gokhale Education Society on 19th February 1918. A tribute to Namdar Gopal Krishna Gokhale on his third death anniversary, and the journey of building a culture of caring and excellence was started. The principle of above self, above politics is guiding Gokhale Education Society for the last 104 years of service. In this astonishing journey till today, Gokhale Education Society has established 156 institutes, including 22 senior colleges, 19 junior colleges, 13 research centers, 15 pre-primary schools, 16 primary schools, 21 secondary schools, 3 ashram schools, 10 agricultural training centers, 12 specialized institutes providing 240 courses in 20 centers under 3 zones: Mumbai, Palghar and Nashik. Gokhale Education Society is the only education society built by teachers, for the teachers and managed by teachers. With human values and social responsibilities, Gokhale Education Society carried the mission of raising the dignity of the teaching profession and flourished the culture of caring and excellence by providing a wide range of value-embedded professional and vocational programs, particularly for the poor and downtrodden, as also for Adivasis and backwards, to bring them in mainstream. Gokhale Education Society is the first to give free education to poor and underprivileged since 1918, providing the lower strata of the society an access to primary, secondary and higher education. The society started first agricultural school in Asia for Adivasis at Kosbad in Bordi region of district Thane in 1920. This 300 acres of campus is dedicated to agricultural education, agricultural research and training. Through agricultural education, Gokhale Education Society has helped farmers to utilize their soil in the best possible manner. That resulted in increased productivity. Simultaneously, power of education motivated the upliftment of the Adivasi farmers. This center has been a major reason for the development of Adivasis and rural people in the vicinity and in India. This agricultural college stands out as it has undertaken major agricultural research in India, which created a long and everlasting impact on agricultural development in India. Gokhale Education Society's Krishi Vignan Kendra have helped more than 2,000 families below poverty line to double their income through the implementation of agricultural and allied enterprises. Gokhale Education Society is also devotedly working on malnutrition issue in these areas through successfully executing nutritional garden program, which has helped these Adivasis live a healthy life. Gokhale Education Society's efforts for helping these Adivasis and farmers to live a better life was recognized by the Indian government and awarded as Best Krishi Vignan Kendra in 2017. Gokhale Education Society started first university-based residential MBA program in India at JDC Bitco, IMSR at Nashik in 1968. Gokhale Education Society started first women's college SMRK BKAK at Nashik as an initiative of women empowerment.
Myself, Dr. Dipti Deshpande, Principal of SMRK BKAK Mahila Mahavidyalaya and HR Director of Gokhale Education Society, takes pride in sharing with you all the valuable contribution that Gokhale Education Society has made in empowering the woman through quality education at affordable cost in its legacy of 104 years. SMRK is the only college in whole of northern Maharashtra which is ISO 9001-2015 certified, NAC re-accredited and running 33 programs very successfully under one roof. Till date, our college has empowered more than 40,000 women through quality education. 15,000 of them, they are well placed, employed and are shouldering the responsibility of the family very successfully. I am very proud that our college is imparting training to Adivasi women at Palghar and helping them out to come out of the problem of malnutrition. Thus, the college is striving very hard to achieve its mission of empowering the woman through quality education by providing empowered citizens not only to the nation but to the globe. And this is done under the able guidance and support of Gokhale Education Society.
Gokhale Education Society started first Polytechnic College for Adivasis at Bordi in 2011. Since 1918, Gokhale Education Society has enlightened thousands of students and empowered more than 1 million lives in rural and tribal-dominated areas near Nashik, Jawar, Bordi, Shrivardhan, Kosbad and Talasari after establishing quality standards in traditional as well as agricultural, management, technical education as well as providing trained quality paramedical staff from last 25 years through College of Nursing and College of Physiotherapy. Gokhale Education Society is now venturing into the field of healthcare management and medical services under the leadership of academic stalwart Sir Dr. M.S. Gosavi.
Today, India is in a very vulnerable position. India is the only country in the world which has 50% of its population below the age of 35 and 65% of its population below the age of 50. And the average age of Indian has increased from 21, 22, which is at the time of independence year, to 70, 73, 74. And therefore, health-wise facilities which are available and coming up from government and also from the private field have added to the longevity and effectiveness of working in the society. Health education is very important in the total field of education. In fact, education and health must go hand in hand so that the economy will prosper with the help of knowledge that the students are acquiring and with the help of capacities and character that they are building through these medicinal branches.
Nashik district has 15 tribal blocks with almost 50% of tribal population. These people even today face many challenges in getting timely medical aid in case of emergency, poor hygiene and sanitation, high rate of malnutrition and neonatal morbidity, lack of awareness regarding the menstrual health or health of expecting and lactating women are some of the grave issues that are observed in these areas.
Education and health are the two important aspects of human development which ultimately lead to high productivity and satisfaction in the society. And therefore, we have decided in the coming 5 to 10 years, we must develop facilities, particularly in the faculty of medicine. We are therefore now launching with the help of our past students and also some of our sympathizers and donors. this medical project where hospital will be established in the campus of about 630 beds in a period of 24 months, the work of which is in high progress and nearing completion for the first phase.
First phase we are planning to start in March 23 with 130 beds and all multi-speciality OPDs. Floor area of each building is around 50,000 square feet, and there will be ground plus 6 floors consisting of around 3,70,000 square feet of total area. This multi-speciality integrated hospital, we call it integrated because we will be giving all the services which are required for healthcare, like pathology lab, radiodiagnostics, OPDs, emergency and casualty department with 30 beds, out of which around 8 beds will be of ICU. Casualty and 28 OPDs for various specialties like general surgery, general medicine, cardiology, orthopedics, obstetric gynecology, ENT, dermatology, and pediatrics. The first floor will be having 10 operation theatres which will cater to orthopedics, general surgery, ophthalmic, ENT, and cardio. This hospital is being situated at the central part of city and which is very easily approachable from all parts of Nasik. The second phase we are planning to complete by 2024 September, that is 2 years down the line. The vision of our society is to provide best quality healthcare at affordable cost to all sections of the society.
It is a matter of great satisfaction that out of 3,000 doctors in Nasik today, more than 50% belong to Gokhale Education Society, who have expressed their willingness to support this cause. And we are sure that if education and health go hand in hand, and we are able to give quality at all levels, and the entire project in the hands of the students at a very reasonable and affordable cost. And this is the dream of the society. And I am sure with the support of all of you and with the blessings of persons I have already mentioned, it will go a long way to make our dream totally fulfilled.
We at Gokhale Education Society would like to reach out to past students, well-wishers, and persons like you for realizing this dream. We have a long-standing and meaningful bond. Your active participation in raising funds and for enriching contribution for this upcoming medical project will definitely strengthen our bond. We would be happy if you inspire more like-minded people to contribute for this medical project, which is being undertaken at opportune time. The patronage from each one of you for this noble cause is welcome. Let's heal the world together, spread smiles forever, and create a better world.